Let me say a special good evening and Happy New Year to Caroni East MP Dr. Rishad Seecharan. Pleasant good evening, sir.
Good evening, Mikee K, and good evening to everyone.
Yes, and all the best to you and your family for 2024.
Thank you.
We heard recently, of course, up to yesterday, the comments surrounding the increase in COVID-19 cases following Carnival. And we heard, well, of course, the Carnival up, do forgive me, 19 cases, and that's locally, as well as the onset of the influenza season, has led the Health Minister, Terence Singh, to encourage face masks, especially among the vulnerable as Carnival 2024 approaches. And we've heard this. Now, what's interesting here is that many of these things that were discussed yesterday and many of these concerns that are currently being expressed, you yourself expressed that in March of last year in 2023. So apparently the question has to be, is it that nothing is being done?
Well, exactly, Mikey K. And what we are seeing as scientists is that what we actually taught over the last couple of years is that COVID-19 would become a seasonal virus. And it would actually be embedded within the repertoire of viruses that we usually have around the world. So we have COVID-19 now, in addition to influenza, as well as another virus called RSV, respiratory cyclical virus. And the reason it's becoming seasonal is because sunlight kills COVID-19 on surfaces. Right. So it reduces its transmission. So during the summer months, in the temperate countries such as North America and Canada and Europe, COVID-19 would be suppressed. And during the winter months, it would actually increase the number of cases in these countries. And what we have during the Christmas period and the Carnival period is we have a lot of tourists coming into Trinidad and Tobago. And there's actually a surge of COVID-19 cases in America and Canada right now as we speak. And of course, as these persons come into Trinidad and Tobago, we here in Trinidad and Tobago would get an increase in the number of cases of COVID-19. Having said that, yes, persons who have comorbidities as well as the elderly have to be cautious because an increased prevalence of COVID-19 among our population would put them at increased risk of severe symptoms. So they should definitely mask up in crowded areas as well as in indoor facilities.
Yeah, but that is not what's being communicated to the general public in the sense that, you know, the minute someone hears about these new cases and the fact that you have a health minister saying you have to put on your mask because there are those who are medically vulnerable, who are easily to catch, you know, whatever, the COVID and the influenza, the first thing that comes to the mind of citizens is, here we go again. When in fact, as you stated when you started, that this is something that has to, you know, it's part of the norm. So the question I have to ask you is that when they talk about the COVID-19 cases on the rise, with data on the 7-day rolling average expected by the end of this week, why is it that, you know, isn't there a running rolling average being kept since the beginning of the period to measure the extent of these infections, if there are any at all?
Exactly. And he has basically been keeping the number of COVID-19 cases a secret. I actually filed a question, and it was due to be on the order paper within a couple of weeks. But, you know, due to the number of cases, he actually let the cat out of the bag, that we actually had 5 deaths from COVID-19 in the last 2 weeks. And even more alarming, Mikey K, is the fact that he refused to prepare. So, you know, he went on record saying that we had to destroy all of our COVID-19 vaccines. Now, you know, there are persons that are susceptible to infectious diseases with comorbidities, persons that may be undergoing cancer treatments, as well as those that are very elderly. They need, from a medical point of view, a booster shot, a COVID-19 booster shot. And we currently have, according to the Minister of Health, no COVID-19 vaccines in the country. So again, he has not ordered any vaccines for these persons in these categories so that they could get an extra level of immunity against COVID-19. And you could go to the United States, you could go to Canada, you could go to Europe, and in all these countries, you can easily get a COVID-19 vaccine by just walking into any pharmacy.
Yeah, well, and yeah, but as well as if it is that we are aware of the period of the influenza season, which runs from October of any year to May of the following year in this country, why isn't there COVID vaccines at hand?
Exactly, and besides COVID vaccines, there are therapeutics as well. So over the last couple of years, I have been asking the Minister of Health to purchase or to procure Paxlovid. Now, Paxlovid is a therapeutic, it's not a vaccine. So basically, if you're unvaccinated or even if you are vaccinated and you have COVID-19 and you take this drug, there's almost a 100% chance, regardless of your age or your comorbidity, that you will survive. And so we don't even have the therapeutics, and this happened last year as well during the Carnival period. So the minister basically is not prepared. We're going into another season of Carnival with a higher number of cases of COVID-19 again, and we will lose citizens in Trinidad and Tobago to COVID-19 because, again, we have no booster shots for these persons that are medically compromised and require a COVID-19 booster shots, according to the medical authorities, as well as we have no therapeutics of high efficacy such as Paxlovid in Trinidad and Tobago.
Yeah, and why are we now putting measures in place to bring public awareness?
Yeah, so public awareness is one measure. That is just a preventative measure. The Minister of Health had a duty to educate citizens prior to the Carnival, to the Christmas as well as the Carnival period, that this could occur. So persons could safeguard their elderly, their grandparents or whoever they may be that may be living in the same household as them. But once again, he has not put things in place. And, you know, in my opinion, one death from COVID-19 is too much, right? There are drugs in the world right now. COVID-19 was a novel or a new virus, but there are therapeutics that could be had that could save these citizens' lives once you are diagnosed with COVID-19.
And tell me, for the listening, for the viewing public, who are the folks in our population that are most at risk of getting, you know, as far as the influenza, as far as COVID, who's at risk more than ever?
The elderly. We have to safeguard the persons that are over 70, the persons that are over 80, as well as the persons over 90, as well as those that may be immunocompromised, persons that are taking radiation treatment, certain cancer patients. We have persons possibly with uncontrolled diabetes as well as uncontrolled hypertension. And COVID-19 reacts, very badly with persons with these preconditions. So we have to safeguard those in our society, those in our population that are most at risk. And that has to be done with public health education. Once again, the minister over the last few months spoke nothing on COVID-19. He was only about speaking about persons that may be obese and the fact that, we have to adjust our lifestyles and obesity and whatnot. But he totally lapsed on COVID-19 education again. And I think it may have to do with the fact that, he doesn't want to scare persons that may be wanting to come into Trinidad and Tobago for the Carnival season. And the fact that we are unprepared medically to treat persons that may acquire COVID-19 should they be in Trinidad and Tobago.
Yeah, but bear in mind, this is the same health minister who told us initially 2 or 3 years ago that having COVID here in this country is highly unlikely because those coming from North America and Europe would be screened thoroughly. So the chances of it coming on our shores is very highly unlikely. But now we know exactly. We've come post-COVID. We've understood all of that. We've lived through all of that. And as you stated, why is it that this vital information is being held back as far as public awareness? Because there seems to be a sense of lacking of trust. When many of the citizens, as I said earlier, hear about these things, they say, well, here we go again. What am I to believe? This is just coming out from nowhere. This is something that we were supposed to be told as far as those of us who are most vulnerable. Why? And you made mention of the fact of having to keep the stats or keep the numbers down. But don't we pay a price for that in the long run?
Definitely. And we will pay a price in the coming weeks. It may be 2 or 3 persons per week that may die for the next couple of weeks. But in my opinion, that is too many. And the fact that COVID-19 is surging. Not to the extent that it was surging in 2 or 3 years ago, but it is surging in the United States. And you could just go on CNN and you would see that.
Yeah.
And these persons are coming into Trinidad and Tobago. Many persons may be COVID-19 positive and may be asymptomatic because they are young and healthy, but would be able to transmit the virus when they are here in Trinidad and Tobago. So they may have no fever, they may have no symptoms whatsoever, but they are COVID-19 positive.
Yeah, and again, we're not getting this information the way we should be. When you look at it, I mean, as far as how things were managed, and of course, information being the key of it all, what should have been done differently?
Definitely, the minister should not have assumed that COVID-19 was gone. In my budget debate up to 2 years ago, explained to the minister that COVID-19 was becoming a seasonal virus and that it would rear its head during the winter months, that those being November, December, January, February.
One second, Dr. Seecharan. Now, this information would have been out there. I mean, you have some of the top advisors to the Ministry of Health. The minister would have known all of this. I mean, to me, it seems as though it gives us that false sense of safety, thinking that this had just simply disappeared. Yes, the majority of the citizens were saying, it's time for us to exhale. We were totally confined to our spaces for far too long. We need to move around. We need to earn a living. We need to make a dollar. The economy was affected. But still, why was that not factored into, listen, it's going to happen next year. It's going to happen the year after that, because COVID is not going away. Why was that not embedded?
The minister continues to drop the ball on all healthcare policies. And in my opinion, more could have been done. We definitely needed COVID-19 vaccine boosters for those that would need it. There's a special category of persons within our population, and we definitely needed to try to acquire some Paxlovid, which is the therapeutic for persons who are COVID-19 positive. And it's a way to treat them and to prevent the pneumonia from happening in their lungs and would cause them to have shortness of breath and difficulty in breathing. And it has proven very, very effective in saving thousands of persons of lives around the world. But, the minister again has dropped the ball. He has done nothing in terms of securing the citizens of Trinidad and Tobago against this. And, unfortunately, we have lost 5 persons in the last 2 weeks, and may their souls rest in peace. And they, of course, thought that COVID-19 was done and forgotten as well. And that fault lies with the Minister of Health, Mikee K.
Yeah, and I think leading into the winter period in North America, we should have had some campaign running simultaneously to let our citizens know that, hey, that period is coming up and we are going into that flu season. So please, you need to safeguard yourself. And I think that was somewhat very reckless and irresponsible of the minister. Now moving forward, of course, and we don't want to, of course, deal with the fear factor, because there are people out there who are very much concerned now because the information is now coming out to them and they're now being told, listen, if it is that you fall in any of those categories where it is that you would be most vulnerable, you need to start wearing your mask again. What do you say to those individuals tonight?
Definitely be cautious. If you are in a crowded area, try to avoid crowded areas and wear a very strong, high-quality face mask, preferably an N95 mask when you are in a non-well-ventilated indoor area or possibly a crowded area. If you have to be in those areas, ideally you should avoid those areas. As well as in a hospital setting, you should wear an N95 mask. A lot of persons wear, these cloth masks, and I would strongly advise not wearing cloth masks. The cloth masks provide almost zero protection against the COVID-19 virus. The COVID-19 virus would actually move through that cloth mask almost as if it was not there. So you have to wear a stronger surgical mask and preferably an N95 mask. Having said that, most of the population, I would say over 95% of the population would have herd immunity, meaning that they would have some level of immunity either from vaccination or having acquired COVID-19 multiple times over the last couple of years. So 95% or more than 95% of the population, COVID-19 would not affect them in any drastic way whatsoever. But it's those persons, those elderly persons, as well as those with comorbidities and those with certain medical issues such as cancer and taking immunotherapy and on radiation and all these different medical procedures. Those are the ones that we would have to try to safeguard as best as we can. COVID-19, according to the minister, has been here since December. We have lost 5 persons in the last 2 weeks, and she is now ringing the alarm bells, and those persons would have to be on notice and have to protect themselves against COVID-19 going forward.
Yeah. Do you think that, I mean, based on the fact that there has been so much that was said and that lack of trust as far as between the citizens and the information that we should have received, looking at management once again, because the conversation isn't going away, and that's for sure. We know COVID isn't going away, and the conversation isn't going away, especially post-COVID. Those folks who were affected with respiratory problems, as far as those with asthma or whatever respiratory symptoms that may have had, what do you advise them to, as far as to deal with that?
You know, they always have to be cognizant of the fact that COVID-19 is here to stay. As I said before, you know, according to many of the scientific minds around the world, it is going to stay here. It will be embedded among the various viruses that currently circulate around the world. And we expect COVID-19 to be here for a very, very long time. And we would definitely see every flu season, probably we would have to call it a COVID-19 season as well. And it's very, very sad that the minister made no attempt whatsoever to acquire any COVID-19 booster vaccines for those that are immunocompromised, and which is recommended by the health professionals internationally for those persons. An average healthy young person or even an average healthy middle-aged person probably would not require a COVID-19 booster shot. But those in those categories would have to get a COVID-19 booster shot. Within my family, my wife actually has a booster shot over the last couple of years, so she has taken the COVID-19 6 times, as well as my children as well. And they have gotten the booster shots in Canada. So those in the medical community understand the need for these booster shots. You know, it goes back to the fact that Minister Gayelle doesn't come from a medical background, and his training isn't in the medical sciences. So he, in my opinion, he may not lack an appreciation of how important the booster shots are. And the fact that we also need therapeutics in Trinidad and Tobago to combat COVID-19. Should someone in these categories acquire COVID-19, there are drugs that can save their lives. And we currently do not have those drugs in Trinidad and Tobago. We currently do not have any COVID-19 booster shots for those that are, you know, in this particular category, being persons with comorbidities or persons that are over the age of 65.
Yeah.
Definitely you have to safeguard yourself, be aware of your surroundings, be aware that the virus is spreading. The virus will spread even more during the Carnival period, where as we get more and more international travelers entering our shores. Under no condition, you know, we would want any type of lockdown or any type of restrictions anymore. But persons that are in these categories definitely have to safeguard themselves to protect their health. And the COVID-19 booster shot, as well as Paxlovid, would have been an extra layer of protection that would have been provided by most governments around the world to protect these persons.
Yeah, I mean, well said. I mean, it sounds good, but at the end of it all, I mean, yes, no one wants a lockdown. I mean, we've all been financially hurt, or some of us even crippled by those lockdowns. But at the same time, if we're going to do our part as citizens, we do expect the ministry and the minister, of course, to give us the information forthright, so we would know exactly these things up front, how to deal with it, and how to make sure and ride out this situation. It can't be the best kept secret, and I think that's totally unfair and totally irresponsible. But again, we've got to make the best of it. We're in the season, and again, COVID is not going anywhere. Any closing comments, please? Go ahead.
Everyone, please be safe. In closing, my brother and his wife actually got COVID-19 in Trinidad and Tobago a couple of weeks ago. He had symptoms of fever and body pains, and by the way, he just took a test, a simple COVID-19 antigen test, and he was positive as well as his wife. So it is within the communities of Trinidad and Tobago. Anyone can have it, and be aware of persons with symptoms of cough, fever, tiredness, body pains, sore throat. Those are persons that would be able to transmit the disease, the virus very easily. And, secure yourselves, secure your relatives that may be within this cohort of persons that are very susceptible to COVID-19. And everyone enjoy the carnival. In the United National Congress, we do not want any more health restrictions. We don't want any more, any more restrictions on our ability to earn. But going forward, the Minister of Health has to do more to educate the public of the dangers of COVID-19, as well as he has to do more within the Ministry of Health to protect the citizens by acquiring certain drugs that I've been asking him to acquire for the last couple of years to protect the citizens of Trinidad and Tobago.
Very unfortunate. Thank you so much for taking time out to link with us here this evening. Very insightful, and keep up the good work, and best of luck to you and your entire team.
Thank you very much, Mikey, and good night, everyone.
See you there.